Hey, how you doing? My name is Angel, and this is my mock presentation for a DNC, aka a dilation and curettage, and a hysteroscopy. Um, my procedures for this my class, surgical procedures 140-7. So, as you can tell, I have no instruments of this kind here. So what I've got is, I did the best I could. I don't have an access to a printer at all or anything. So I have these flashcards. I'm just letting you see. So then what I'll do is I'll walk you through a little bit of what's supposed to happen. And I'll tell you about a little bit of these instruments. So right now I want to start with a hysteroscopy. I want to but first, before we dive into everything, I want to I want you to see that I am in proper attire that I'm supposed to. I got my head cap, I got gloves on, both sides, and then as you go down, I got my scrubs, I got my shoe coverings on, and I have the newest addition, which is my mask. So let me tell you a little bit about hysteroscopy. So pretty much what that hysteroscopy pretty much is it's a procedure where the uterus is the inside of the uterus is being examined to see if there's any like polyps or fibroids or stuff like that present. So let me run you a little bit about the steps of the procedure on how a hysteroscopy is supposed to go. So first things first, I want to let you know now that that Mrs. Graham, I'm sorry. I know this doesn't look like it, but I don't have access to a printer, so I've got some pretty good ideas. I had to do the best I can, so hopefully you don't dock my grade too bad. But I had to find something similar to give like an example of what a hysteroscope would look like. And it's kind of something like this. It's probably a little bit smaller. It has a sheath that goes over it, and as it's entering the lower part of the cervix to investigate into the uterus, there's a little tiny scope there too. And something like this too. These are like what would go into a hysteroscope. So this is pretty much what this is. This is like a biopsy forceps. But just imagine, this being for like a hysteroscope. And then I want to show you too, like these are kind of like what's similar to like the pieces that are kind of like this. So like I said, I don't have a printer or anything. I did the best I could. So I'm just walking you through right now, like a lot of the instrument parts here. So briefly, real fast, what I want to say is, as we start to get ready to perform a hysteroscopy, what we'll do is we'll have the patient, the patient will be positioned lying on their back, and then they'll be in how do I pronounce that word? The lithotomy position, and there will be like some boards she can rest her feet on for leg boards for the lithotomy position. So, and then what's going to happen is the patient will be given the patient's prepped, and when I mean prepped, like they'll be prepped down by like the vaginal area, probably thighs, and a little maybe the beginning of the stomach, cord to the umbilical cord. But what will happen is, so once some anesthetic has been given to them, we'll start by what we have here is the procedure will begin with the insertion of vaginal speculum. So what that do is they'll insert these into the vagina, opening it up wider so that way they can see the lower parts of the cervix and going into the uterus. So what's going to happen from there is then after that's going to happen, then because the uterus is small, so what they'll have to do is they'll have to dilate. So, and we look here and we got some dilating instruments here. So if we look there, you know, got different ones. So we'll start from the top. We've got these right here are the Hager cervical dilators. So what's going to happen is this is going to go into the cervix, and they're going to go in from one small one to the next bigger one to the next one. And I think pretty much maybe like this is the surgeon's surgeon's preference, but these are for dilating to accommodate for instruments to go in. So this is the Hank, and this is the Pratt cervical dilators. So then what's going to happen after that, once these dilators have made their way in, then we have a hysteroscope. Like I said, this is not a hysteroscope. It's just something like this. So what this is going to do is this is going to examine the inside of the uterus. So, but before that even happens, they have to inject the uterus a little bit with I believe a little gas, just to give it to open it up a little bit so it can move around and see clearly. So then what we have here is we have a Varus needle. So what this is this is disposable, so it's inflation needle. So and it's connected to this tube. So this is how they're able to open insufflate the uterus so they can see. But then, like I said, so then as they start the procedure, what they'll be doing is they'll be looking to see if they see any like polyps or any evidence of fibroids. And if anything, then what they'll do is they can come in with that. These are just examples, so don't mind that here. So this is like an alligator grasper. So kind of think of something like this going into this here. Kind of like, you know, if they had to cut and grab something and pull it out, but just being a little bit smaller, like kind of like this here, like this biopsy. Like this biopsy forceps here. And then, like I said, then they would use, you know, like Metzenbaum scissors, you know, like for this small one. So that's kind of something like it would look like. I said, these are examples. It's the best I could do. I don't really have anything. So, but, yeah, so that's like we would do for hysteroscopy. So like I said, they're just going in to examine, and if they find anything, they're able to, like polyps or fibroids. Polyps they can just cut and take right off and pull right out and stuff like that, and then send it to a lab to get a test out. So now I want to talk about a DNC now, dilation and curettage, Curettage, yeah. So now what is this here? So pretty much what a DNC is, it's a transcervical removal of a superficial endometrial tissue. So what's going to happen is so obviously, you know, the speculum is going to be in place for that to open up the vagina. And you know, so that's what's going to happen. So, and now, just like I said, the cervix is going to be dilated with either the Pratt, the Hank, or the Hedger, uterine dilators. You know, after cervical dilation, you know, what's going to happen is curettes are used to remove the endocervical and endometrial tissue. So what's going to happen is you see these interesting things right here. So what they're going to do with these is the surgeon or the doctor who's ever performing this. Let me just pick this up here. So a little bit about this. This is a uterine curette. It's used. These instruments are used during dilation and curettage, like I said, at DNC. And the function of these instruments is to scrape the inside of the uterus due to retained contents or excessive bleeding. So if they're looking to take a specimen, so these things can either be sharp serrated, or smooth. So what will happen is I'll take this here, So take this, and I'm just going to imagine like this being a uterus. So here's uterine crest. So they're going to take that part and they're just going to, just kind of drag it down like that to get a specimen. And like I said, in most cases, if they were just looking to get a better shot at that, if they were just using to get like a better sample, what they would do is, if they were just getting a specimen, they would do a little bit. But if they were doing something to treat something, as I read in the book, they would take it and they would just keep on scrape everything out. So I don't know. I think I've never heard of these procedures before. It's the first time I've ever heard about it reading a DNC and a hysteroscopy. But I didn't, I didn't think that they were able to. I thought like when they did something like with like a hysteroscopy, let's just talk about like they have the hysteroscope, and I didn't think that they're able to have the knowledge to send small devices through like scissors or graspers, like to snip polyps and stuff like that. I didn't really think they had that. I thought they would just go, they would do the scope first and then they would go in kind of like blind, but I guess, you learn something every day. Like I said, these things here, like I said, this is just an example. This is kind of what like the devices would look like going into a hysteroscope, and that's kind of something similar to it too. Like I said, these are not the actual scopes. I'm sorry, Miss Graham, I did the best I could. Like I said, I don't have access to a printer and everything, but I did everything else. It took me a long time, not a long time, but it took me a bit of a work too. And like I said, this is an example too. I just wanted to see like what the pieces would look like coming into that scope. They'd be smaller, but I did the best I could with what I had, and I hope if I do get a grade, it's not that bad of a grade. But anyways, this concludes my presentation. I feel like I learned a lot, and I feel like I want to keep going, so I'm looking forward to doing these videos each week for you for different procedures. And Mrs. Graham, as always, I appreciate your last minute advice and you helping. So before I go, I'm just going to make sure and name everything. So that was used in these procedures. So obviously we got an open and closed vagina speculum. Okay. And then we have the Hank, we have the Pratt, and we have the Heger cervical dilators, and we have the uterine curettes. And like I said, these are just, and this is like the Veris, this is the tubing for the insufflation. This is the Veris needle. And then like I said, these are just examples. This is not an actual hysteroscope, but this is like the best I can do. So like I said, this is like somewhat of what it looks like. Not quite, but a little different. But these are, like I said, thank you again. And the other instruments that usually are required for hysteroscopy, like I said, it's usually like scissors, graspers, and kind of like a suction. So, but thank you, Mrs. Graham. I appreciate it. And thank you, class.